Good evening, everybody. Muy buenas tardes, bonsoir, to those who are joining us this evening for the third session of our Caribbean Climate and Health Responder course, Education for Action. My name is James Hospedales, and I'll be your moderator for this evening. Today's session is looking at water and food-related illnesses and how the whole hydrosphere interacts with us. I acknowledge the partners for this program: Columbia University Global Consortium on Climate and Health Education, our own EarthMedic and EarthNurse, Pan American Health, UWI, and the Caribbean Institute of Meteorology and Hydrology, whose principal we have a pleasure to have with us today. Live interpretation is available in English and Spanish. Use the button on your screen for the Zoom. So this is the second edition of our course, and we're on session 3 covering water and food related illness. Last week we had over 500 people attending the sessions on climate change for health professionals and over 600 for extreme weather hazards and hurricanes. So we look forward to this evening's session on water and food related illness. The learning objectives for today start with looking at the hydrosphere. How do droughts and heavy precipitation affect the hydrosphere, and what are the implications for water availability, quality, and supply? What are the factors that make individuals and populations more vulnerable to health impacts from climate-related changes to the hydrosphere? Also, to be able to apply that knowledge of climate impacts on the hydrologic cycle to the incidence and prevalence of common waterborne pathogens, bacteria, viruses, and parasites. Describing how the climate change affects all 4 dimensions of food security, foodability, and stability of food supplies, access to food, and food utilization. And discussing the relationship between food, animal, and plant agriculture and greenhouse gas emissions, such as methane and carbon, and the co-benefit of improving diets to address malnutrition and mitigate climate change. So those are our learning objectives for this evening's session. Just to remind you of the logistics, the session is 90 minutes long, including an expert lecture and case study presentations. The sessions will culminate with a question and answer session. Please enter your questions in the presenter's Q&A. That's then curated and fed to the presenters. Sessions will be recorded and posted on the website within 24 hours, and the reference materials and slide decks are also included on the website. We also post these reference materials, the link to them, on the WhatsApp chat for the course. So if you haven't already joined, please do. It's a great way to keep informed. A certificate of participation is available for those who attend 7 of the 10 sessions and pass the final exam with a score of at least 70%. That certificate is awarded by EarthMedic, EarthNurse, and the Global Consortium for Climate and Health Education. You must join the class session using your personal unique Zoom link and complete the final exam using the email address you initially register for the course. Attendance is automatically recorded during the live sessions. For CME credits, continuing medical education credits, 1 credit is applied per session. The credits are awarded by the Caribbean College of Family Physicians. You must complete the survey posted in the chat at the end of every session. I repeat, you must complete the survey posted at the end of the session in the chat, and it'll also be shared on the WhatsApp link. So, on to our stellar cast for this evening. Opening batting will be Steve Maximay, who is a well-accomplished and recognized guy in the agriculture and environment and food sector. He's a plant pathologist by his initial training, and his first consultancy was, well, I can't tell you how long ago, then you'll guess how old he is. But it was with Pan American Health in St. Kitts and Nevis. He's a climate-smart agriculture and marketing expert with the Caribbean Soilcare project, was a presenter on the landmark Climate Change and Health in Small Island Developing States Conference, and a regional voice on the links between nationally determined contributions, the NDC, and non-communicable diseases. He's an advocate for increased research with respect to the parallels between soil and gut microbiomes. He's a One Health and latterly a planetary health pioneer. He will be sharing perspectives on climate change and food-related illnesses. Dr. David Farrell is the principal of the Caribbean Institute of Meteorology and Hydrology. And I first met David about 9 years ago in the field after that terrible tropical storm Erica in Dominica. We were there with the Secretary General, and I learned a lot from David on hydrogeology, as he brings 15 years of experience in that field and approximately 8 years experience in various aspects of applied geophysics. In addition to his administrative responsibilities, he's involved in various Caribbean and international scientific projects related to hydrogeology, hydrology, and geophysics. He's a member of the Technical Advisory for Regional Disaster Management and Climate Change Projects, the technical specialist supporting the government of Barbados on their review of the Archcot cave-in, and he's a World Meteorological Organization hydrological advisor to the British Caribbean territories. Our third presenter will be Linnees Green-Baker, who is a graduate of the Caribbean Climate and Health Leaders Fellowship. She's a dynamic and experienced public health officer with many years of proven experience and distinguished service in the field, adept at developing and implementing public health strategies, policies, and programs to improve community health outcomes. She's skilled at fostering community engagement and building effective networks to address public health challenges, and is dedicated to promoting health equity and advocating for the well-being of all individuals. She's an environmental health specialist in the Ministry of Health and Wellness in Jamaica, holds a master's in public health and health promotion and education, a bachelor's in environmental studies, and diplomas in meat and other food inspections, works in public health, community sanitation from various institutions. Her technical skills include public health inspection, regulatory compliance, health promotion, health protection, health management, leadership, and network mobilization. So you can see we have a great combination of climate science and health professionals to be talking to us this evening. Our next session is going to be heat-related illness and mortality. So at this point, I'm just going to stop sharing and pass over to our opening presenter. Over to you, Steve.
Hello. Can you hear and see me?
Hearing you fine.
Great. Thanks for the introduction, James. I have a disclaimer. I have been allocated 20 minutes. I am going to be spending those 20 minutes engaging with you. I will not mention stuff that you know already, like the names of diseases and illnesses, and I will not attempt to play medical expert. But what I am going to promise you is that we are going to be dealing with some of the issues that have been hidden in plain sight for a very long time. And when I get into my presentation, you'll see what I'm talking about. But I'm also promising you, albeit a day late, a solar eclipse. Because a lot of the issues that surround food-related illnesses and climate change are really hidden in plain sight. And without a solar eclipse, you wouldn't appreciate the fact that there are stars that are visible, that would be visible if it wasn't for the strong glare of the media and science. So with that said, let me share my screen and start my timer. Can everyone see my screen? James?
Yes, see.
Okay, great, thank you. So I'm starting my timer as of now. Okay, so I've been asked to speak about climate change and food-related illness. And I want to affirm from the start that we are going to be talking about a lot more than just foodborne diseases. All of these conditions and issues existed before climate change, but climate change is the big exacerbator. And climate change often negatively impacts the availability, stability, accessibility, and utility of food supplies. Now, in terms of how it affects availability, the destruction of products in the field during transportation and during storage requires very little explanation. And a lot of this stuff in the first 2 or 3 slides, you can Google, and I'm sure you already know. So I'm just running through these so that we can deal with the solar eclipse coming to the end. Stability. How is it affected in terms of disruption of supply chains? It is not difficult to understand how an extreme event or flooding can mess up a supply chain. In terms of accessibility, which has to do with how you access the food, where you get that food. Damage to infrastructure, damage to groceries or food storage complexes. And there are times when climate change impacts may not damage the actual physical building in which the food is stored or available or accessible, but the infrastructure leading to it is impassable because of floodwaters or landslides, etc. In terms of utility, well, that's a good one. In terms of the impacts on the quality and safety and the nutritional content of the food, so that you can easily understand how food can get contaminated. And this is the segue that I'm going to use to talk about the more direct links between climate change and food-related illness. Now, when we talk about foodborne diseases and the direct impacts, we are talking about biological issues, leptospirosis, bacterial and other viral type issues that can be literally spread by water and wind and as a contaminant on your food inputs and on feed for animals and livestock. As I said, I'm not going to give you a lecture on leptospirosis and all of these diseases because you know a lot more about that than I do. But suffice it to say that there are going to be issues, including chemical issues associated with flooding, the inappropriate use of chemicals against these pest populations that have increased due to climate change, due to the differences in circulatory patterns, wind patterns, and so, and the widening of the range of activity of some of these pests. And although I've been more or less referring to food supplies from terrestrial sources, we have to include also marine and aquatic food sources. And this is where bioaccumulation tends to be a major issue. In terms of physical contaminants, this is less common and primarily forcibly carried through wind and water during harvesting, field packing, etc. And I have personal experience with this in terms of the very few instances where we have mechanized harvesting of dry peas. And so we have actually seen the type of contaminants that can be thrown into the mix, as it were. And since some of these products are already shelled and then packaged, it can lead to some issues in terms of physical type contamination. But what about the indirect? Some of these indirect issues include things like biological contamination. And this is not to be confused with the more direct impacts. This is the type of contamination that comes because of inappropriate or inadequate techniques that have been occasioned on us by climate change. So that there's a lot of talk about climate smart agriculture, let's say, and increased use of terms like composting and using animal manures and molding up plants way above the color region. And what happens in cases like that is that composting, if it's not done properly and you are using material that hasn't properly broken down, most common examples are things like H. pylori, especially in vegetables and so that are not going to be cooked. And that is a major source of that type of biological contamination. In terms of chemical, the inappropriate and prophylactic use of chemicals because of the impacts or the perceived or the anticipated impacts of climate change. So it means in advance of a flood event or in advance of heat stress, there are chemicals that are being applied prophylactically that can induce chemical type illnesses. And then in terms of physical, here we are not talking about the direct impacts, but we are talking about the reduced availability of, let's say, potable water, so that food material that is going to be consumed is less likely to be cleaned properly because of water shortages. Now, this is where I'm really interested in sharing with you, because as James mentioned, these slides are available for you. So I'm just going to be reading quickly through to get to the areas that I really want to concentrate on. So that undernutrition is easy to understand in terms of the impacts on availability and the accessibility and the utility of the foods. But what is less often discussed is the supercalorific intake due to highly processed and so-called affordable imports. Now, what climate change has done, it has induced these reduced availability of locally produced fresh produce and augmented by slick advertising. And I'm hopefully going to have some time at the end to get into some more details about what I mean by slick advertising and dredge up the horrific history of coconut oil in the region in terms of its combating of slick advertising with comparisons to soy oil. And eventually the global syndemic, which, as the description on the slide shows, what happens when you have these biological factors working together to make a disease or a health crisis worse. Now, climate change can be considered a pandemic because of its sweeping effects on the health of humans and the natural systems on which they depend. And this is where people like James come in and myself when we keep talking about planetary health. Now, as you can see there, this climate change is an exacerbator of malnutrition in all its forms. And these often hidden indirect impacts of climate change on a plethora of food-related illnesses are based on these three items that I'm going to quickly run through and hopefully have enough time for us to have a face-to-face solar eclipse discussion on. So the first of it would be climate change policy. So you may well ask yourself, what does climate change policy have to do with food-related illnesses? Well, some of the prioritizing sectors for nationally determined contributions, which James mentioned, and which I hope, again, I'll get a chance to discuss in some more detail later, that puts emphasis on activities that may not necessarily be in the best interest of your food supplies. Ill-defined climate-smart agriculture. I mentioned one of the more glaring examples of climate-smart agriculture projects or approaches that have not been well thought out, and the use of uncured manure, compost, etc., can lead to serious, if not fatal, consequences. Failing to recognize the importance of non-industrial livestock production. And this, I wanted to hasten to correct James on his hinting that one of the ways that we can mitigate climate change would be to watch our consumption of meat, red meat, especially. And this wasn't a conversation other than today, but I'm hoping that we can get a chance to discuss that more fully, because what we are dealing with in the region and in SIDS generally is non-industrialized livestock production, where we're not talking about deforestation and clearing large swaths of land for pasture production, etc. And then disregarding indigenous and SIDS-based research directions, such as germplasm from climate analogs. Now, again, in a discussion on food-related illnesses, this is not public fare. When we are talking about germplasm from a climate analog would be an area in the world, a region where they're either going through similar type climate change impacts as we are experiencing now, or we are predicted to experience. So that practical examples of this have been the work of CARDI, the Caribbean Agricultural Research and Development Institute, where we access Dasheen and taro varieties from the Pacific that were salt tolerant, heat tolerant, and we are now using them in St. Vincent and other parts of the Caribbean. So that policy blindness in that respect can be responsible for increasing our food-related, indirect food-related issues. Now, that's another biggie. Multilateral agencies reinforcing nutrient-dense as opposed to high-calorie food production and distribution choices. Now, my very first foray with PAHO, as James mentioned, was in St. Kitts, and I can tell you it was in 1981, many years ago, and we were looking at food and nutrition surveillance. And that's when I first got introduced to the concept of empty calories. And far too often, what we have had is a dependence on highly processed imported foods that have been providing empty calories. That is why you will never hear me talking about food security. I always tend to drift into nutrition security, because this love affair we have with a 2,000 calorie diet, those 2,000 calories can be sourced from 20 soft drinks, I guess. And I don't think that's what we mean when we talk about food security. And then the national designated authorities, and these are the people who control the pipeline of funding from the Green Climate Fund and other multilateral agencies. They often promote agricultural investments with high return on investment. In other words, they are promoting agricultural projects that can generate revenue so that we'll have the fiscal space to import more food. And that more food may not necessarily be more nutritious. So again, following my screen quickly so that we have some time to discuss the underlying issues. The required transition to a climate-smart agriculture was not occasioned by producers who must now adapt and mitigate. For such transitions to be just, the required solutions, protocols, etc., ought not to be forced as part of an externally driven agenda by multilateral agencies using technologies, goods, and services from the global north. And it is difficult to have this kind of discussion without mentioning terms like just transitions, climate justice, and climate finance, which, as I said, I'm going hustling through these so that I'll be able to have that discussion with you. So to briefly recap, that's where I was heading. And I now have 5 minutes and 53 seconds to engage you in the way that I would prefer, which is to stop sharing and have a conversation with you about some of these terms that I keep bandying about the place, like climate justice. What do I mean by climate justice? Climate justice, a quick analogy, and this is the first time I'm using this analogy with a room full, a seminar, a webinar full of medical professionals. But the quickest explanation of climate justice is this. Imagine you're walking down the street one day and somebody walks up to you and slashes you, I mean, violently. In any part of the world, That's a crime. I mean, you would think that you should take them to court and you should easily win that case. And lo and behold, you do take the perpetrator to court and you win the case and you're awarded a $50,000 settlement to fix you up, to literally patch you up since you've been slashed so violently, only to find out that the surgeon, that the person who slashed you is actually a surgeon and he's the person who's going to be fixing you up. So in other words, you're rewarding the perpetrators. And that is what is at the core of climate justice, in that we have the moral authority to complain about an injustice that was meted upon us. And lo and behold, we are finding out that whatever compensation we get from the court of public opinion or the court of moral justice, whatever source, is now being used to allow the perpetrators to double dip. Why am I being so blunt? Because there's a concept called common but differentiated responsibility, which drives all of the climate politics around food. What does common but differentiated responsibility really mean? Another analogy, a quick analogy. We have 3 minutes and 29 seconds left. Another quick analogy. You're living in your residential area, there's a factory uphill to you, and they constantly throw thousands of plastic bottles into the drain running in front of your house. So much so that your drain constantly floods. Your house is flooded out on occasions. So, of course, you want to take them to court, only to find out that they saw your son dropping one solitary plastic bottle into that drain. And they are now telling you that we will accept responsibility, but it must be common but differentiated responsibility. In other words, you are responsible as well, regardless of the minuscule, the 1 or 2 gigatons of carbon dioxide that you contributed to this issue. The major emitters are saying that, look, there's such a thing as common but differentiated responsibility. And you now have to tell us what you are doing to be able to have the moral authority to tell us to stop tossing those bottles into the drain. You must have told your son that he ought not to drop any bottles in the drain as well. So that is the concept of common but differentiated responsibility. And it is based on that you have all of this talk about nationally determined contributions. Because as a major outcome of the Paris Accord, each country, each signatory country has to explain to the world, what are you doing about your one plastic bottle? You only have the moral authority to ask us to grant the climate finance that we are winning from the courts of moral opinion and moral justice if you can tell us, what are you doing and how are you being more ambitious in terms of the emissions that you are going to reduce. And it is because of all of these intricacies that the food import situation is at the stage that it's at. As I said, I've attempted to just take away some of the spotlight from the more commonly pursued issues to talk about some of the peripheral issues, the asymptomatic issues that surround food-related illnesses that have been occasioned by climate change and climate crisis. And I can assure you, I have 55 seconds left. You can find out a lot more about these approaches if you go to the YouTube channel that bears my name, and you will see all of the intricacies involved in the politics of food and the climate politics of food that impacts our health. Thank you.
Thank you very much, Steve, for
30 seconds.
Thank you very much for the discourse on food and food security and climate justice.
And nutrition security. Not food security.
Food and
Please.
nutrition security go together. And there was a call for you to talk more about the just transition, and perhaps in the question and answer, you can say a bit more about that.
Yeah, but I wanted to stick to the time, so.
Yeah, no problem.
Yeah.
We'll have some time at the end.
Great.
Thanks for the review of that area, and now we now crossed 600 participants. Good evening, good morning to everyone who has joined us, and we're not gonna switch now to Dr. David Farrell, who is the principal of the Caribbean Institute of Meteorology and Hydrology. Over to you, David.
Okay, can you hear me?
Hearing you fine.
Okay, so I just need to share my screen. Just give me 1 second. Am I sharing yet?
We're still seeing your presenter's view. You need to go to
Okay, let me try again. Is that sharing now?
I think we're seeing your whole screen, including your letter to Latoya Archer in Ministry of Foreign Affairs.
Okay, you shouldn't be seeing that. Okay, how's that now?
That's looking like it now.
Okay, so I assume you can see my screen now.
Yes, David.
Okay, thanks. Hi,
Oh, hi, David. Sorry, we can see your notes. If you want to change it to full screen.
I'm on full screen. How's
There
that?
you go. Looks good.
Muy bien.
Okay.
Very
Okay, thanks. Okay, so as James said, my name is David Farrell, and I'm the principal of the Caribbean Institute for Meteorology and Hydrology. I've been here for now approximately 18 years. And so I'll start by just saying 1 or 2 things. My first interaction with the health sector was really during my years working in nuclear waste disposal, and everything was about health. And so that became a really important part of trying to understand how systems work. And I'll talk a bit more about systems and how systems work. But the first part of systems and how systems work is I want to run a scenario by you. So let's assume that you guys are the Ministry of Health, which you're health professionals, and I'll assign James to be the Minister of Agriculture, and I'll be the meteorologist, and so or climate scientist, and so I will say to James, we have good rainfall, and James will say crop production should be good, and so James goes to the Prime Minister or President and says, we'll have good agricultural production. And the Prime Minister or President goes ahead and makes commitments about how much money should be available to spend. But they haven't spoken to you guys who are the Ministries of Health, because the rainfall that is going to occur is going to have a significant impact on health. And that means that essentially most of your farmers are sick, which means that at the end of the day, there's no good production. In fact, because all the farmers are sick, you have very little production. And so you have this commitment of money, but you have no income coming in. And so the challenge here is that sometimes we don't talk to each other. And so we don't talk in an integrated way. And the key thing here that you can take from this presentation is the need for integration in terms of decision making that includes the health sector and includes all sectors. The water sector, the health sector, they're all related. The water sector, the agricultural sector are related. Everything's related. And if you look at the tourism product, it always says it always encourages buy local. And so we have a connected set of systems, but we don't necessarily always talk to each other. As Jim said, I go to quite a number of disasters, and there are two ones here. One is Maria, and the other is Rosebank. And this is after the 2013 heavy rainfall in the Eastern Caribbean on Christmas Eve. And you can see that you have community loss, you have individual loss. From a health perspective, certainly one talks about disease and disease outbreak, but there's also the psychosocial impacts. In fact, after going back to Rosebank, after the several years after the Christmas Eve floods in Rosebank, I went back to Rosebank. And one of the things that was still present for people are psychosocial challenges. People say when we get thunderstorms, they hide because they're afraid that the hills will move or another boulder will come down and destroy property. And so we have this challenge with the health sector in different ways. Just one slide about CIMH to put everything into context. We play a lot of roles in the Caribbean, from training to data collection, research, instruments, climate services, earth system simulation, sand and dust storm warning, and more recently, marine science. But the key thing here for the health sector is that we collaborate with almost everyone. And that's how I met James and some other people in the health sector. It's through collaboration. And so from a medical point of view, you guys can ask us questions about climate, and you should feel free to engage us in any way, which way possible, because that is the role that we have been given to work in the area of climate, but also weather, water, and geoscience. So most of you will be familiar with this, and I know that this is probably small on your screen, but in Barbados is an ongoing conversation that started about 6 months ago. And probably every week it is discussed in Barbados, this concept of whether Barbados is water scarce or not. A lot of people said there's a lot of rainfall, and so we can't be water scarce. But the reality is that we are water scarce and we are water challenged. And there are a number of islands in the Caribbean, if you look in the bottom of the screen, that are water challenged. And they're receiving less than 1,000 meter cube of water per year per person. In the case of Barbados, it's about 250. In some other islands, it's less than 200. And so we are faced with these water challenges, which have a health impact. From the perspective of the medical profession, there are two areas really that are driving water scarcity. One is rainfall, limited rainfall, but the other is water quality. And so you may have a lot of water of good quality, you may have a lot of water, but it is not of good quality. And so you're still water scarce, unless you can come up with a way to treat that water and make it usable. So there are these challenges with water scarcity, and they affect different people, and the most impacted are females in most societies from water scarcity, and it leads to healthcare challenges in some societies. The figure on the right is really the hydrological cycle, and I think most people are familiar with this. Evaporation from the oceans forms clouds, and you have precipitation, you have runoff, you have infiltration, you have deep infiltration, and you have outflow of groundwater. For islands, what you'll see is this, and I hope you can see my mouse, is this feature here. This is how salt water intrudes into groundwater systems. And one of the things that will happen is if you reduce the amount of infiltration, deep infiltration, you will exacerbate seawater intrusion. And so you'll move from this location to that location. So you can imagine reducing the amount of rainfall that you're getting, and seawater intrusion starts to go further and further into your systems. And you can imagine that you have pumping wells and you start to suck salt water up. And this is a common problem in most Caribbean countries, is this problem of saltwater intrusion and saltwater intrusion getting into deep into groundwater systems, getting into well systems, and then one pumps the systems. If you're using it for human consumption, you talk about a dose. And if you're using it for agriculture, you don't probably use the term dose, but what you will end up with is irrigating fields with poor quality water. We have examples of that around the Caribbean, where we've irrigated fields with poor quality water, and as a result, the quality of food that we grow diminishes, as well as the amount of food that we can grow because of these types of problems. And I'll come back to this later on. And Tanisha Stevenson last week spoke about the state of the climate report, so I'm not going to reiterate that too much, except to talk about two things here. And here I summarize climate trends and consequences. So one is we have an expected change in rainfall patterns. We're going to get drier by 2100. The number of dry days will increase, which means we're going to have reduced infiltration. And if you remember the figure before, it means we will have more seawater intrusion in coastal aquifers if we're not careful. We will have more frequent occurrences of drought. For people in the Caribbean, 3 of the most intense droughts on record occurred in the last 30 years, starting in the period 1997. Then we had 2009, 2010, and then we had around 2014, 2016. The impacts of these droughts on society change as we put in place information products, and I'll not go through those at the moment, but they will come later. But one of the things that we'll have is intense rainfall. And so we're going to have a lot of runoff because we're not going to be able to infiltrate all of that water. So we'll have reduced recharge, and then again, we'll have saline intrusion into coastal aquifers. But we'll have increased soil erosion in some locations and landslides. This will cause turbidity, especially at water intakes on rivers, and the potential for chemical pollution at surface water intakes due to agrochemicals and other industrial chemicals being transported in runoff. And so this is one of the things that will impact health systems and health outcomes. We will also have increased sea level rise, and the numbers for sea level rise are changing constantly, and it's not getting better, it's actually getting worse in terms of the amount of sea level rise and when it will occur in the future. But it will also have impacts on groundwater systems. And then we'll have elevated temperatures day and night time. That's going to impact human health, increase rates of heat stress and dehydration, but it will also have impacts on agriculture. So we'll have reduced soil moisture due to higher evapotranspiration rates, and we'll also have heat stress for livestock and so on. The figures on the right really talk about what will happen. The first figure is about precipitation, and the mean precipitation will decrease, but the variability about the mean will increase. Sorry, the mean precipitation will decrease and the variability will increase. And similarly, you have the estimates of sea level rise on the right. And so in coastal areas, when you have sea level rise and you have storms, you have the potential for significant flooding in coastal areas because you've got runoff that can't get into the ocean, and you have the sea intruding onto land masses. And this will be a major impact in the future. The way that we've looked at the problem is we've tried to take a more integrative approach. Rather than treating each hazard separately, we have to treat them in an integrated fashion and allow for cascading from one hazard to the other. And I'll provide an example of that. But we'll have to integrate climate modeling with hydrometeorological modeling, with marine modeling and geological modeling to really get a better feel for what is happening within the system. Now, these are all more the physical sciences, but wrapped in all of this is water and health. Depending on how systems cascade, we'll have different health outcomes. And so we may start off with a rainfall event that leads to a flooding event or a landslide event that will have health impacts. Whether that is that we are able to get to medical facilities or that people are injured or dying, these are the health impacts that will occur short-term and long-term. Can people get medicines after some of these events? And so having the health sector involved in these types of discussions becomes critical as well. And so we shouldn't have these conversations with just the physical scientists, but certainly having the health professionals involved in this so that they understand risk and how risk cascades into the medical professional. We talk about system of systems integration, and coming from systems of system of systems integration, how we push everything together. We have health processes that have to be considered and health outcomes that have to be captured. And here I just showed risk matrices for different types of events. And so you can have a risk matrix that says likelihood is high, medium, or low, and you can have potential impact. So you can apply this to flooding, and you can have a series of actions at the end, but it all relies on integrating systems. And so many of you may remember last week, the question I asked at the end is the health profession prepared to integrate its data with all the other data sets so that we can start talking about health processes and outcomes being captured in systems integration. As an example, if you look at the figure on the top right, this is St. Vincent and the Grenadines, and this is December 2013. And so the squares that you see represent rainfall, essentially. But captured in all of this are hospitals, clinics, police stations, ambulance stations, etc. And so we can start looking prior to a disaster to start looking at which health systems are going to be cut off and which ones are not going to be cut off so that people are better prepared to respond. And one can start repositioning medical supplies. So the climate water health nexus. And I pulled some stuff from different people. And one talks about a Caribbean story. And it starts really with the Caribbean is no stranger to devastating effects of climate change. And it talks about the challenges that will occur where we have increasing frequent intense storms, hurricanes, sea level rise, droughts, and they all contribute to water pollution, contamination, dehydration, and the spread of waterborne diseases. And one of your colleagues witnessed it firsthand and really started to understand the challenges that come about from the integration of climate, water, and health. Certainly the impact of Hurricane Maria on Puerto Rico in 2017 is a prime example of how damaging water supply systems can leave hospitals, clinics without safe water, resulting in a surge of waterborne illnesses that place vulnerable populations at risk and serious health. Barbados is also grappling with conversations around this area. And certainly Barbados is talking about reduced amounts of water available for basic hygiene, chemical and microbial contamination due to increased droughts and gastrointestinal diseases. Again, as I point out, we are water scarce and we're challenged. In addition, water scarcity may result in water storage and vector-borne diseases. And it was reading on this that I realized that Barbados has the highest incidence of dengue in the world. I didn't know that, but certainly that is from the way we manage water. And for people who are familiar with Guyana and the floods of 2005, this is just a situation report from Relief Web that I downloaded. But it talks about the number of people who were impacted and were in shelters in Guyana. We talk about 192,000 people being affected. We talk about floods up to 7 feet in the worst areas and so on. We talk about floods and impact on health facilities in regions in Guyana. 25% of facilities were impacted and so on, impacting 75,000 people. And then we talk about some of the impacts that people had, whether it was fevers and rashes and so on. But one of the things that that come to mind is that in some instances, the first responders are the ones who are most exposed to some of the health challenges that occur. And so from a medical point of view, being vigilant with regards to even the first response teams and getting them to understand the risk they face becomes important. Now, in terms of current and emerging water quality challenges, certainly we talk about salinization, and that's expected to increase. We talk about siltation, that is also expected to increase due to enhanced runoff and effective land use and land management policies and lack of effective control structures. Nitrates will continue to increase because we're going to have increasing populations, increasing number of homes, and our waste disposal practices are weak. Pesticides and fertilizers, we can expect those to continue to increase in our surface and groundwater systems. We have overuse on farms and residential properties, as well as poor waste disposal practices for pesticides and fertilizers. Then we have industrial and persistent organic pollutants. And these are expected to increase, and these are from manufacturing. And we talk about increasing manufacturing, increasing the number of vehicles, and again, poor disposal practices. But the one that probably appeals to you guys the most is pharmaceuticals. We can expect an increase in pharmaceuticals in our surface water and groundwater systems unless we come up with ways to better manage pharmaceuticals. And the figure on the right is from the OECD report, where it is now a global concern, the amount of pharmaceuticals in the water system. And if you look down at the bottom in particular, 88% of human pharmaceuticals are without environmental toxicity data, but yet they are present in large volumes within systems, the environmental systems. One of the concerns is over prescription, self-medication, misdiagnosis, and increasing pharmaceuticals in the environment. And the table just provides some of the adverse effects of certain pharmaceuticals in the environment on aquatic organisms and human and animal health. But one of the concerns certainly has to be that our children are getting access to our medication through the water system. And that's alarming and of significant concern. And in fact, I think even in the Caribbean, even though the numbers are not as high as in North America and parts of Western Europe, one can expect that number to increase unless we improve waste disposal practices in the Caribbean. Now, I said I would come back to this figure, and certainly when we look at how things are moving in the subsurface and surface, we get certainly runoff carries with it sediment, and sediment ends up in surface water systems, as we see here. And so we have increased sedimentation. When this happens, we have to shut down water intakes. When we shut down water intakes to prevent contamination of the drinking water supply, people look for water elsewhere. And so that poses a challenge. Where do you look for water? Certainly, with Hurricane Maria, it was the first time I ever bathed in a river. And so it was an experience when people start looking for water and just for basic hygiene purposes. We also have the concern, like I said, of homes. And we have waste from homes that will get into the deep system. And the red dots are my attempt to show contamination. That contamination ends up in the marine environment. But we also have runoff from farms and so on, and farms and agricultural areas that end up in our water systems as well, surface water systems, and end up migrating into the ocean system. And so the ocean system then starts to absorb a lot of our waste. And so we start seeing declines in the environment and so on. James, how much time do I have?
I think, David, you're coming close to your time.
Okay, that's fine. I'll just move along quickly. But the figure here just shows what happens in disasters. We had a disaster in Haiti. This is the Haiti earthquake. We have soil and so on moving around, rivers being blocked and so on. But we also have significant rainfall event coming over that particular area 3 days later. And so this is a displacement map for soil. This is looking at rainfall. And so we can see the nexus between the earthquake and the rainfall event. But trapped in this are people. What decisions are people going to make? Which clinics are going to be open? Which clinics are going to be closed? And how are people going to get medical support? We also had the situation from Erica, James, and you talked about Erica. But we have here we have the nexus of rainfall against landslide susceptibility. And when this happens, we have significant impact. And we have over 30 people dying in just one community as well. Again, the medical professionals have to be aware of the challenges that are faced. But we also have water intakes that have to be closed. And again, we run into this problem of water and health coming about from Erica as well. James, I can stop here if I'm out of time.
Thanks, David. Thank you. And thanks for that tour de force explaining that we're in for hotter, drier weather, but with inundations of rain that are going to pose challenges to health and health services. You had a lot of examples from different Caribbean territories with all the experience you have, and the need to tackle things in a more integrated way, including integrating data from the health sector and from climate services. And thank you for offering CIMH and the resources you have there for those who are working in the health sector to better understand this nexus of water and health. So we're now changing gear we've had two gentlemen. We're now going to change gear to hear from Linnees in Jamaica. Over to you, Linnees.
Thank you very much. I am just wanting for you to confirm that you're seeing my screen and in full view.
Yes, seeing it fine, Linnees.
All right, thank you so much. Good afternoon, good morning, as I'm seeing some persons saying good morning to all that are joining us. And I just want to thank Dr. Hospedales and all the organizers for the opportunity to present. So I am supposed to present the case study. Now, even though the published case study will be highlighted and you will have access to the presentation with it, I want to focus on the public health impact. And both Dr. Maximay and Farrell would have covered some of the aspects that I would want to speak to. So I'll skip those slides and focus on the public health implication and what is our role, how do we go from here. So that's what I want to focus on as we go along in my 20 minutes. So just to put things in context, in terms of the challenges, we would have appreciated from all the presentations so far that rising temperatures is resulting in rising risks. So we look at, in terms of our focus this afternoon, on water safety and food safety and implications for foodborne and waterborne illnesses. So if we focus on rising temperature, the spin-offs here, we looked at tropical cyclones, we look at the implications or impact from flood rains. And even though we are not going to spend a lot of time focusing on droughts and bushfires, I mentioned those because they also have implication for foodborne and waterborne illnesses. So in the Caribbean, already established that we are very vulnerable, and increased intensity of weather events we will be seeing, experiencing now and in time to come. We looked at the fact of water and food security. And as I said, my focus would be on the burden in terms of human health and its far-reaching consequences, all right? So again, our focus in terms of case study, which we're looking at, but because of how integrated we are as a region, the implications are the same for all our countries. So you will hear me mention, and again, I'm from Jamaica, so you'll hear me using a lot of examples and lived experience from Jamaica to coincide with the case study. So the case study will focus on the social and ecological interactions in a disaster context, and the focus is on Puerto Rico and Maria. And you would have heard also Dr. Farrell mention and the implication that had in terms of disrupting water supplies, not just potable water supplies, but wastewater system and infrastructure, and the impact that had on healthcare delivery. So here, when you would have accessed the PowerPoint presentation, you can have link to the full case study. So just for us to have an appreciation of the case study, in terms of introduction, it mentioned, and I'm careful, I probably at the end I'll be a disciple of the phrase in terms of nutrition security as opposed to food safety, but food security. So in the case, it mentioned the impact that the hurricane had on the farmers, not only on the overall production, but their as it relates to nutritional impact of their health and well-being in terms of malnutrition. So domestic farmers, it stated that they had a key role, as we would have appreciated, in producing food. Now in the Caribbean, we rely on 90% of our food being that from import. So you'll see the implications it will have for us in terms of security. As islands too, we are particularly susceptible, as we would have established already, to food shortages. And we want to also look at how difficult it would be for us to receive aid. Again, Dr. Farrell spoke about Haiti. So if we look at our historical colonization or our heritage, we would appreciate that most of our settlements are along the coastline. So let us say we have the impact of the events, and we have rising sea level, for example, or we have the sea surges coming in. It will impact our infrastructure, to include our healthcare facilities. So these are some of the vulnerabilities that we would have experienced, and that the potential disruption of our systems as well as our supply chain. So just an overview of the case. In 2017, Puerto Rico was hit by Hurricane Maria, which was a Category 5 storm, and it caused widespread damage. And please note the areas highlighted in blue. Damage to the island's infrastructure. And since our focus is on water, the water system, and I want for you to bear in mind, not just the drinking water or potable water systems, but also our wastewater system. And as we get further in the presentation, we will see again the interrelation of everything. So the hurricane also caused power outage. When we talk about food safety and temperature abuse and high-risk foods that are required to be kept and attain and maintain certain temperatures, we see the implication for foodborne illness outbreaks as a consequence of impact from weather events that are climate related. We established already in terms of extensive damage to agriculture sector. So we are looking at in terms of even incorporating the whole OneSep One Health concept of damage to crops and livestock and farmlands. So we are looking at healthy alternatives. We talk about the nutritional value. So we are making healthier choices. Organic farming, as was mentioned, in terms of the use of fertilizer, you know, and composting. So these also too will have implication for foodborne illnesses, right? So in the recovery, if we are trying, let us say our ports have been impacted adversely and we are trying to help ourselves, then we want to use sustainable methods, and these are some of the alternatives that are available to us that could also pose challenges. So moving along, these are graphics, and if you look at the collage to your left, this is in relation to Puerto Rico and Maria. And while I was doing my research, within the same time period, even though Jamaica was not directly impacted or in the path of Maria, we receive the torrential rains as a result of that system. So on the right, if you look carefully, you will see almost a mirror image. So looking at the lower right-hand image for Puerto Rico, you see where an entire roadway has collapsed, exposing infrastructure, and you see the potable water lines. And if you look on the upper left-hand image for Jamaica, the same thing happened. We look at the inundation of water, and for Puerto Rico, the same thing happening in Jamaica, where you see houses, infrastructure almost completely submerged underwater. And you look also at the implication for mudslides and landslides, and how this will also deplete. We look at the hydrological cycle just now, how this have implication for depleting the nutrients in soil. And as a result, you'll have lower crop yields, and then it will also impact nutritional value. So these are some of the impacts we're seeing and the parallel with Puerto Rico, and I'm sure other Caribbean islands. We learned about what happened in Bahamas rather, with Dorian, and the same, because we are of the same disposition. So how is climate change polluting Caribbean waters, right? And how is it sparking more illnesses? So we spoke about the widespread inundation. Now, if you look, and these are images from Jamaica. Now, this is an entire roadway that has been impacted. I was searching very hard to find a sewage treatment plant that would have been impacted. I could not find any online, but I would have seen for myself in doing post-disaster investigation, where we have our sewage treatment plant completely flooded. So you use your imagination now, when that get mixed with other potable water supply, the implications. So automatically, you'd want to make sure that you render that water inaccessible. So as a part of the disaster response mechanism, you will have the water suppliers shutting down the system as a preventive measure for mitigating against damage to the infrastructure as well as contamination. So it would mean then that persons will be out of access to water as they would for a period of time. Dr. Farrell also speaks about the turbidity, which refers to the suspended solids and organic matter that is in the water, because you'll allow, even though the water is in abundance, it's not accessible. So we talk about water availability, and we talk about accessibility. So it's there, but you're not able to access it for the particular use, be it domestic or for institutional operations. We talk about the impaired functions of potable water system based on the impact of flood rains, contamination of water source, and also mentioned in the previous presentation, the interaction with hazardous materials and organisms. So these are some of the ways in which it's impacting our water. So the risks in terms of waterborne illnesses, we see we can get waterborne illness, water becomes contaminated, and they said we become ill. In terms of foodborne illness, we can be impacted by consuming unsafe or water that has become contaminated, or even food. Again, Dr. Maximay made mention of, for example, vegetables, where we would use probably unsafe water post-event. We'd use unsafe water because we do not have potable water readily accessible. So we'd use those to whether to prepare or to clean areas, and you will have food becoming contaminated, or you have incidents of cross-contamination where you're moving dirty or germ from one area to an area that was safe before. We also would have learned in terms of the importance of proper hand washing. So you see another modes of transmission would be that from hand to mouth. And of course, we look at vector-borne diseases, because with increased temperature and increased rainfall, it makes it ripe for an increase in vector-borne diseases, because you have a proliferation of the vectors. Well, this is the slide that I'd want to spend most time on, because this speaks to the fecal-oral route of transmission of diseases. Now, gastroenteritis, which is diarrhea and vomiting, is an indicator, a very good indicator or proxy for foodborne illness. However, in our systems, these are generally underreported. So one of the things that we have to be mindful of, as Dr. Maximay also said, what I want to do is highlight the things that are in plain view, the things that we do every day, but we might have to do differently. In terms of, for example, differential diagnosis, how do you differentiate or make the correlation, say this is what is happening? We talk about information sharing. I'm seeing a spike in diarrheal diseases or cases of gastroenteritis after an event. Is this a pattern you're seeing now? How does this inform our policies? We talk about climate-related policies. How are we going to shift the narrative by being proactive? Because public health is preventive medicine. So as we examine this diagram here, we could see where we can link both implication for foodborne as well as waterborne illness, because of the, as displayed here, the complex interplay between water and food-related illness. So going back to the slides, which you would have seen the inundation of the water impacting infrastructure in terms of wastewater systems. So persons would not have access to their normal route. Persons will probably or typically seek alternate ways. So here we have the diagram starting with feces. And this image is popularly called the 5 Fs of fecal-borne disease transmission. So the first F we want to look at is that of feces, right? And then from there, we see the route it can take, whether access, because this is now exposed to the elements, not in a protective way because we're not operating under normal condition. So we can have flies getting access to that. It can be passed on contamination through fluids, which is the water used, or the fingers. Then we have it getting into our food and moving on to another host. So what we need to do in terms of public health practitioners, we have to have an appreciation of this, and we also have to promote this, because one of the other things we need to look at, most of the times we want to consider, for example, in a disaster setting, we want to look at how infections are spread. Another implication for climate-related health burden in terms of disease for water and food transmission. We look at hospital-acquired infections, for example, and most of the times we tend to look at the patient, but what about the workers themselves? So we have to look at it now in a context of an occupational hazard. So in a setting where you're operating, again, we want to make reference to the situation that was explained in earlier presentation with Dorian, where you have to operate from field hospital. COVID, we would have gone through that too, where you do not have the ideal setting. So there is the potential or the risk for workers, healthcare workers themselves, because by virtue of their occupation, to fall ill or to become susceptible to infections, whether it be food related or generally or in waterborne illness. So in terms of intersecting this mode of transmission. If we recall or visualize the triangle, the epitriangle of disease, where you have the host, the environment, and the agent, and the interaction, it is said for you to disrupt the disease cycle, you'd have to put control measure at least one to intercept one. And it's the more you put in terms of barrier, the most effective. So using this diagram, the most effective barrier would be right after the image where the person is utilizing the field as for depositing feces. So you want to put a barrier there. So you want to have systems in place. So it goes back to your preparedness level again in terms of mitigation. What are you going to have in place? How informed are your plans and policies based on the hazards you face? All right. So we want to also look at the public health related illnesses. And I don't want to spend a lot of time on this since that was mentioned already. In terms of, we want to look at the direct and the indirect impacts of the events on the food and water related. So we look at weather, looking at morbidity and mortality. Persons actually will die and will get sick. We look at the psychosocial impact in terms of mental health impact, where persons know are triggered, have higher stress levels and anxiety because you're anticipating some event to come. We would have examined the water and food related illness and also the vector-borne zoonotic diseases. So for food security also and food safety and nutritional security, as we would have learned this afternoon, because we would be facing higher temperatures, it will cause surface water to disappear. We look at over extraction, which was mentioned, and in terms of salination, saline intrusion because of over pumping. We look at water use from potentially unsafe source. And we talk about decreased crop yield and the implication that will have for our nutrition and also for food storage and increased prices. The Caribbean is said to be one of the areas that has the highest food prices, and that also have implication for lower nutrient intake and malnutrition. So in terms of the survey data from the case study in Puerto Rico and Maria's impact, that 405 farmers were surveyed, and 65% of the farmers said that they were food secure at least 1 month after the hurricane. And 38 of them reported that persisted onto 3 months. And this graph will explain to you in terms of how long it would have gone on and the different persons who would have said they were vulnerable in terms of not having food. So what is the role, in summary, what is the role of public health? Public health is preventive medicine, as was established. What we need to do, as we're doing through this forum, to promote health and efficiency in being prepared, and also to prevent disease and disabilities, to ensure that we establish early warning systems by linking data, establishing trends, and establishing policies and guidelines, and also to prolong and to protect the quality of life. And we not only do so in terms of emergency. So emergency systems, we need the ability to respond not to just normal situation, but also in emergencies. So in concluding, water and food-related illness in the Caribbean are linked to climate change, and it's a significant public health challenge. Governments and health organizations in the regions must take proactive measures to address these issues. Domestic farmers have a key role in producing food and for the local market, which can safeguard food security when food importation may be challenging. And in the context of disaster, farmers themselves may be vulnerable to food insecurities and unable to contribute to the domestic market. So moving forward, the recommended action includes for health leaders to take decisive and deliberate actions. Here in Jamaica, we want to share that we started looking at how our health systems can become more efficient. We are looking at improving water, sanitation, and hygiene policies and doing assessment of our facilities to see where we can strengthen them. And also, we want to make sure that our capacity building and development of our officers there in terms of training. We learned earlier too that we are the trusted voices. So therefore, we are to promote climate literacy as we are doing through this forum. All engagement, every clinic setting, every opportunity we have one-on-one. Let us reach people where they are, find out how they connect with climate, some of the things they might not appreciate, but where they are, reaching them at their level and sharing the information. So our call to action, we are in this together. So let us work together to mitigate the impact of climate change on water and food security in the Caribbean region to protect the health and well-being of our population. Thank you.
Thank you very much, Linnees, for another great presentation. Wow, I'm like a bit blown away. Our presenters have been from Grenada, from Barbados, and from Jamaica, and they did not confine themselves to their countries, but we had information shared from all the Caribbean territories, from Guyana and South up to Bahamas, Puerto Rico, Haiti. So well done to our presenters. We have a little bit of time for questions and answers. And as the moderator, I'm actually overwhelmed by the numbers of questions. We will not be able to get to all of them. But what I'm going to try and do is pitch a few questions to each of our presenters. David, there's quite a few for you in the hydro area. Steve, for you on food. So let me just pull up my other slide. I won't be showing it. I'll just be working with it to pull some questions for us all for another 5 minutes or so before we wind up. So David, there are questions around things like the role of rainwater harvesting, and can that help with water security to offset water problems that we face? And that was from Dr. Desiree Providence. Also questions around the issues of waste in water from pharmaceutical and other wastes. And then finally for you, David, what can healthcare and infrastructure, what can we do in terms of marine engineering? What support can come from floodplains or sea walls? For you, Steve, a question, differentiating between a syndemic and a pandemic, what would be an example of that? Climate benefits of vegetarianism, and how can that help both our developing countries and natural ecosystems? And a question about the just transition. Who's actually doing anything about this? Our governments, our labor unions, or just a few NGOs? So I'll pause and let you guys pick up on some of those questions.
Oh dear, James, you got to go slow with the questions. Rainwater harvesting, can it help? Yes, is the answer. Rainwater harvesting can help quite a bit. In fact, I am working on something for the government of Barbados, and part of it deals with rainwater harvesting for agriculture to bring a certain level of support to a rural farming community that is water challenged. And so to augment some of the challenges that they have, one, looking at treatment of gray water, but also rainwater harvesting as well. And if we can put those together with the available water in the groundwater system, then we should be able to sustain farming in the region. But certainly, I'm going to be a little bit hypocritical here and say that everybody should rainwater harvest, even though I'm not rainwater harvesting at home as yet. But certainly, it is something that that we all need to be able to do, and we should do. James, you had another question. The first question, I can't remember what it was.
The question was around managing water and the pollutants in water, including pharmaceuticals. Yeah,
the big challenge, and I don't know how many people that are online live in Barbados, but this is the whole issue now of wastewater treatment is the hot topic in Barbados right now. And whether you treat to secondary or tertiary and you re-inject water back into the system, this is now a controversial topic for people in Barbados, but certainly we have to improve the way that we manage waste, household waste. The common practice is you have a well in your yard and you put everything in the well and it magically goes away. It doesn't magically go away. It ends up back into the system, back into your groundwater system and back into your marine system. And so it is there. And the only way to really deal with this is to have good waste treatment facilities in countries, sewer systems that are well managed and that allow us to, even if we re-inject or use the water for agriculture, to be able to get harmful chemicals out of the system. At the moment, we're not doing that. And you had one about seawalls?
I'm gonna give you a break and switch over to Steve, or else we'll be completely out of time, and then one for Elise.
Okay, so let me just quickly tackle one of the low-hanging fruit, no pun intended, to deal with the vegetarianism argument. Fortunately, unfortunately, I'm at the age where I still remember the days of PEM, protein, energy, malnutrition, and the work of some of your colleagues, James, at Mona, that were able to, really address it. I have a really serious issue with vegetarianism as a solution. If for health reasons or for religious reasons, you have a strict vegetarian diet, I have absolutely no problem with that. But you cannot insist that this is your way of assisting with the climate crisis, because all of these vegetables that we are anxious to produce in systems where there are no livestock within the farming system, you cannot have these so-called organically grown vegetables. So that our insistence on having a mix of protein sources and with the co-benefits of having them be the animals that produce the manure, etc. That to me is one of the low-hanging fruit that that doesn't extend any argument to, as far as I'm concerned. So that vegetarianism as a health choice, as a religious choice, fine. But it is not, in our part of the world, it is not a mechanism to address the climate crisis, because you're not talking about industrialized agriculture where we are cutting down large swaths of land to grow cattle. And our small ruminants give us an advantage in this part of the world. So that, to put in a plug there for the Bajans and so, black belly sheep, but I don't want to carry on. I want Linnees to have a chance to, to share the spotlight with a preventive, medicine.
All right, thank you so much. So I want to weigh in on the question that has to do with rainwater harvesting. So it is necessary, but we have to do so in context, right? Because we might be creating another set of problems. So we have to also balance that with our water usage. We waste a lot of water. So if we look at the whole smarting of the healthcare facilities, it will be putting in more efficient infrastructure. So we manage the amount of water we use. So I saw somebody typing in the chat that they are doing water recycling. We have in Jamaica too, where we have some sectors are experimenting with dual piping system. So for example, the rainwater harvesting system would go towards like flushing toilets or irrigation purposes, because you do not want, especially, and again, I'm talking from a public health healthcare facility, institutionalized, you do not want for you to have the rainwater systems, you're not cleaning it, you have it stored there, and you're mixing it with a potable water supply, because you could be creating further problems. Increasing the number of cases of gastroenteritis you have rather than minimizing it. So you want to make sure that you have, whereas you're doing this, you have system in place to monitor, evaluate, and regulate these systems. But this is something that Jamaica is exploring from the development stage as well as in our healthcare facilities.
And just a disclaimer, a quick disclaimer, I do not have shares in Coverley. But I think Coverley is a very good example. For the non-Bajans, it's a housing development in Barbados, where I was lucky enough to live for a couple of years. And I can tell you that with the underground systems on the dual waterways, and so, you know, it is really a first-class attempt at having a climate-smart community.
Yeah.
And this is not a paid advertisement, so I'm leaving it at that.
I wouldn't tell Mark Maloney.
Yeah, exactly.
So I can confess that in my home we have rainwater harvesting, and one of the challenges is managing the mosquitoes. You have to keep that rainwater covered and not allow
With a fine mesh.
yeah, you have to be on top of that or you end up with a dengue problem. But I definitely think there's a role for rainwater harvesting. Some of our countries, the Caribbean, to get planning permission, you have to have a cistern.
Yeah, I was going to mention that.
Ladies and gentlemen, we've come to the end of our session this evening.
James,
Our presenters, Steve Maximay, David Farrell at CIMH, and Linnees Green-Baker. I think the number of questions and the fact that 600 people are here still at the end testify to the interest in this. And in the chat has been posted the link to the survey that you need to fill and indicate whether you want CME credits or not. And then the last thing I will show is just to give a little preview of next week's a little sneak
Thursday's session.
Sorry, yes. Thursday's session on April 11, we will focus on how to beat the heat, temperature-related illness and mortality. Someone posted in the chat that a landmark ruling took place in Europe where a group of women, mostly over the age of 70, brought a case before the European Court of Human Rights, and it was voted that the court ruled that their rights were being violated by climate inaction by their government. So that's a little sneak preview about some of the heat issues we face, and the session on Thursday evening. Please join us then. So thank you very much for joining us today. You can join the WhatsApp group for updates and information from the planning team. The link is in the chat. And you can do the post-session survey, scanning with your phone camera, or the link is in the chat. Thank you all again to our presenter.
James, can I just say one thing?
Go ahead, Dave.
I just encourage everyone to look at the last slide in my presentation. I didn't show it, but it shows that we are tied to the Amazon and the water quality of the Amazon closer than we ever thought through marine freshwater fluxes and the challenges to fisheries and so on, and food security. So I just take a look at the slide.
And the bioaccumulation implications of that, heavy mercury and all that, yeah.
Yes.
Thank you, David. Yes, we were discussing that in another context, the issue of and how it's affected by the Amazon outflow and the outflow from Western Africa in the equatorial currents that are circulating. So yeah, no man is an island. No island is so insular that they're not affected by everything else. Thank you all very much. It's been a wonderful evening. A good night, and we see everyone again on Thursday evening. Thank you very much.
Thank you.